First slide, can you go back to first slide? Okay. The study name is Humidity Levels Inside Newborn Incubators Used in the Neonatal Intensive Care Unit NICU. This is an observational prospective study. Next. The objective of the study is to record and evaluate the effect of different levels of humidity interruptions on the magnitude of humidity loss in commonly used incubators inside the NICU. As we know that humidity is an essential environmental factor to be considered when managing a preterm infant below 30 weeks of gestation. Premature newborns are at increased risk of water loss through their skin, leading to temperature instability, dehydration, and electrolyte imbalance. Next. In summary, in this study we investigated the effect of different levels of humidity interruptions by testing the humidity loss when incubator doors, windows and roofs were open. So we use two incubators and we test the humidity loss when we open the doors and windows and the roofs. And also we measured the humidity loss, and the restoration time to 85% was measured to access the common perception that frequent interruption of the incubator humidity was associated with loss of humidity that take place a long time to restore. The study showed that humidity restore time was changing between 1 minute to a maximum of 15 minutes, depending on the number of windows open. When comparing, the giraffe incubator was able to rebuild the humidity within the incubator more effectively than the dragger incubator throughout the 20 minutes measurement. Clinically, this data indicate that humidity loss is not significant during those clinical procedures which last less than 5 minutes. In longer procedures, both incubators were able to restore humidity quickly enough not to adversely affect humidity stability inside the incubators. So what? As we know that the humidity is an essential factor to be considered when managing the preterm infants below 30 weeks of gestation. The preterm newborns are increased risk for water loss through their skin, leading to temperature instability, dehydration, electrolyte imbalance. So humidity up to 90% is used to dramatically reduce the water loss from the skin to the surrounding environment and can significantly prevent these adverse effects from occurring. Method we used, these are the method. This is an observational study, observational prospective study. It did not include any patients. The methods are, this study was conducted inside the NICU, and the incubators we used are giraffe omnibird incubators and dragger air shield incubators. And the investigators observed 10 clinical procedures, and each procedures were observed 10 successive times. Next. And the giraffe incubator, when we, this is a slide, this is a it's a brief summary of the time and the water and the humidity loss. For example, when we open one window for 5 minutes, we notice that 2% of humidity loss. And when we opened two windows for 5 minutes, we observed that 5% of humidity loss was noted. And and also with the three windows for 5 minutes, it was 18%. Four windows for 5 minutes, it was 19%. For one window, for 10 minutes, it was 3%. For 15 minutes, 3%. Similarly, this is the table. Humidity loss during common procedures inside the incubators. These are the procedures we observed: morning care, diaper change, OGT feeding tube insertion, blood extractions, peripheral line insertion, PICC line insertion, intubation, brain ultrasound, echocardiograph, applying nursing CPAP, surfactant administration. So during morning care, we use two one-side windows. The average time of the procedure was 11.5 minutes. So we observed the humidity loss when we did the morning care and measured the humidity loss. Same way, all these procedures. And the physical intubation process lasting to. The result was humidity loss inside the incubator was 1% to 7% loss during the first 3 minutes of exposure. The humidity loss difference between two incubators when 1 and 2 windows were open equal throughout the test. With 3 windows open, humidity loss was increased in the giraffe incubators 1% to 40% versus 3% to 20% in the dragon incubator, particularly when windows are open more than 5 minutes. Results. When 4 windows open, the humidity loss was more preserved in the giraffe incubator during the first minute, 1% to 19% versus 9% to 31% in the dragon incubator. Beyond the 5th minute, the rate of humidity loss was equal in both incubators, that is 33 to 41% in the giraffe incubator versus 36 to 41% in the dragon incubator. This is a slide that's showing that humidity restore time when windows open for 5 minutes. This is another slide, humidity restore time when windows open for 20 minutes. These are the windows. 1 window, 2 windows, 3 windows and 4. The next slide, the humidity restore time when roof or side door opens for 20 minutes. Side door open for 5 minutes, roof open for 5 minutes, side door for 20 minutes and roof of 20 minutes. In conclusion, the humidity loss is not that significant when newborn incubator windows are open for 5 minutes or less. At the lengthiest clinical procedure, humidity loss can be restored within maximum of 10 to 15 minutes when using the modern available incubators. The maximum humidity loss was observed when one door or roof of the incubators was open. The minimum humidity level reached was 40% in both incubators. Future steps. There is no available similar study addressing the changes in humidity level with different types of clinical interventions. Humidity is very essential for management of premature babies, and we strongly recommend the incubator manufacturers to maintain the standards of their equipment. Thank you.